Okay. How about Rafida Al-Karbushi? Rafida, your audio, we cannot hear. Yeah, I saw her. It's fine. Okay, next. Shamsa Al-Shari.
Yes, doctor.
Sulaiman, okay, your number?
Doctor?
Yeah. Abdullah. Abdul Salam?
Yes, I am Abdullah.
Okay.
Yes.
What's your number?
1264 91.
Okay, thank you. Shamsa Al-Shirayani?
Yes, doctor. 129259.
Nada Al-Shukaili? Nada Al-Shukaini?
Yes, doctor.
Okay.
129434.
Okay, thank you. Shaika Al-Kuwaiti?
Yes, doctor. My number is 129522.
Isra Al-Dughaisi?
Yes, doctor. 129638.
Okay. Basma Al-Nasibi?
129753.
Okay. Nur Al-Makbali?
Yes. 129806.
Thank you. Bushra Al-Katri?
Yes, doctor. 129816.
Okay. Intisar Al-Mawali?
29937.
Again, 1, 2.
129937.
Warda Al-Siyabi?
Yes, doctor. 130111.
Okay. Okay, next. Rim Al-Nabani? Rim Al-Nabani? No. Muna Al-Badi?
My ID number is 130233.
Okay. Aryam Al-Saadi? Saidi? Aryam Abdullah Kalfan Al-Saidi? No. Aisha Al-Adawi?
Yes, doctor. 130352.
Okay. Maryam Al-Saidi?
Yes, doctor. 130409.
Okay. Nasuwa Al-Hakamani?
Yes, doctor. It's Nashwa.
I'm sorry, okay.
130438.
Umayma Al-Balushi?
Yes, doctor. 130480.
Asma Al-Sinani?
Yes, doctor. 130517.
Aisha Al-Awaisi?
Yes, doctor. My ID 130606.
Iman Al-Salti?
Yes, doctor. My ID 130647.
Yusra Al-Shamali?
130677.
Al-Harith Al-Salmi?
Yes, doctor. 130760.
Reem Al-Riyami?
Yes, doctor. 130851.
Muna Al-Fazari?
Yes, doctor. 131049.
Husayna Al-Abri? Reem Al-Nabhani?
Yes, doctor. 131378.
Yusuf Hardan?
131610.
Okay. Zainab Araba?
Yes.
Yes, your number. Come on. Okay, I'll go back to you. Again, Tawasul Al-Balushi,
Yes, doctor.
number.
119997.
Haura Al-Hinay,
What?
Haura Al-Hinay. Haura Zaid Hamoud Al-Hinay, absent. Diana Al-Uwaimri, Diana, absent. Warda Al-Siyabi,
Yes, doctor. 130111.
okay. Reem Al-Nabani, I think this is
Yes, doctor.
Reem.
130, 142.
Okay, the same name. Reem Hilal Sulaiman Al-Nabani, correct? Okay. Aryam Al-Saidi. Aryam? No. Busaina Al-Abri? Busaina. Okay. Okay. Okay, for those students, these are the official list of our students in theory. However, I think there are some students who are not listed there. Kindly send me through the chat box your complete name and student number so that I can add you in the attendance because I'm going to start my class. Okay, so is it okay? Okay, before that, I want to check if you can see all my slides now. Can you see my slides? Can you see the slides? Okay, yes. Okay, so good afternoon, everyone. Welcome you all to our second session in Fundamentals of Nursing. And we're going to officially start our class, our topic for this semester. Okay, during our discussion, if you have a spare mobile phone with you, because I might be asking some questions that requires you to use your cell phones, if you have cell phones there, I want you to actively participate in our discussion for today. Okay, and I hope that you are able to access our PowerPoint presentation, and I hope at least you did some readings with regards to our topic this afternoon. Okay. Okay, now let us try this one. Okay, I want you to get your mobile phone if you have. If you don't have, it's fine. Okay, and I want you to put this one in your URL in your cell phone. Come on. Type in poll, POLLEV.com, okay, slash LEDOROLEBRA 314. Put it in your URL, and there is a question that will appear in your cell phone. How do you feel today? I want you to choose your answer so that I will know if you are with me. Come on, use your phones. How do you feel today? Let us see. Okay. Oh, okay. We already have some responses. Use your cell phones. Type poolev.com slash Leodoro Labra 314. Let me see your answer. Okay, I can see some smileys, 67, 75%. I can see some angry face, 25%, okay. Some other answers? Okay. Okay. Anyway, it seems that you have your phones with you, and it seems that most students are angry and they keep on changing their answers. We're going to use this application later on when we practice some questions. Thank you so much. Now we're going to proceed with our topic this afternoon. Okay? For this afternoon session, our topic is about asepsis. And throughout this session, this would be our learning outcomes. And at the end of the day, after 1 hour, these are the expected learning outcomes that we wish to discuss. First, we're going to identify the different agents or microorganisms that causing infection. Number two, explain the types of infection because there are several types of infection. Also, part of our learning outcomes is to describe the chain of infection. How does infection occur? The fourth one is methods of interrupting. How can we address infection? How can we stop infection? We're going to discuss it this afternoon. And of course, number 5, the nursing management of the patient with infection using the nursing process. Now, in your slide right now, you will see a hospital setting, obviously. And I know some of you have already visited hospitals. And for those who have not visited the hospital, I know that this is what you expect in the hospital. You know, you can see nurses, you can see doctors, the surroundings. Okay? This is your expectation. However, the reality is, when you go to the hospital, these are the actual scenes that you can actually experience. Okay? Okay, please kindly turn off your audio. Lyman, please do not mess up my PowerPoint. Okay, now, this is expected when you go to the hospital. The moment you work in the hospital, even if you see that the surrounding is clean, in reality, there are a lot of microorganisms in there. Okay? They cannot be seen by our naked eyes. However, the reality is most hospitals are infected with microorganisms. And as future nurses, you will not only be dealing with microorganisms, you will be taking care of patients with infection. Okay? You will be dealing with family members with infection. And you will be working in an environment with a lot of infections. With that being said, since you are all working as a nurse in the future, you need to have a knowledge about what is infection. You need to understand how infection occurs, and you need to understand how, as a nurse, you can help prevent infection. That is our goal of nursing education. And I hope that when you graduate from our college, you know exactly how to deal with patients with infection or how to deal with an environment with infection. Now I will proceed. Okay, the word infection I know is very familiar with you. And I know you can hear the word infection. And the word infection means it is an invasion of susceptible host by pathogens or microorganisms resulting in disease. The definition is very simple. Once a microorganism, pathogenic microorganism, attacked the body system of a person and it resulted to disease or illness, then infection will occur. And normally, infection is caused by basic microorganisms. And on the slides right now, you would see the 4 common microorganisms, or in some books, we call it as pathogens, okay? Pathogens or microorganisms. These are the common microorganisms that causes infection to the patient. And one of the most common microorganisms that can cause infection to the patient is, of course, the bacteria. Okay? When you go to the hospital, there are a lot of cases of bacterial infection. This is very, very common. However, there are also other microorganisms that causes some diseases. We call them as viruses. These viruses are smaller than bacteria. Okay? These are smaller than bacteria. For example, the coronavirus. The coronavirus is an example of disease or infection caused by viruses. Okay, there are also some other microorganisms that can cause infection to patient. We also have some fungi. I know you are very familiar with fungi. And of course, you are familiar with parasites. Okay? Parasites are actually microorganisms that lives in other organisms and is transmitted to the patients. The 4 of them are called microorganisms or pathogens, and they are the common causes of infection to the patient. Okay, now, you've been hearing the word infection, and you know already that when we say infection, the microorganism attacks the body system of a patient. However, there are several types of infection that you will encounter when you go to the hospital, okay? Depending on the extent and degree of involvement body organs. The most common type of infection that is common in the hospital is called local. From the word itself, local means a specific area. The infection is limited to a specific part of the body. For example, you have a wound in your hand and it is infected. The infection is called as local infection because it is in the specific part of your body. Or if you have some wound in your face, for example here, and it becomes infected, the infection is only on this area that is called local infection. The key word there is a specific part, particular part of the body. However, if the microorganisms is transmitted to the entire body, it started from your hand, because of the wound, it gets infected. It started from local infection. However, because you are not able to treat it, it spread into the entire body. The microorganisms spread into the entire body, then the infection is called systemic. From the word itself, system, the entire system is involved. And normally, if the patient has a systemic infection, microorganisms, bacteria, virus are normally found in the blood. And the mere presence of microorganisms in the blood is called, you can see on the slide right now, it is called asepticemia. Okay? Sorry. Once the microorganisms is found elsewhere on the blood, then it is called septicemia. Okay? Again, local infection, specific part of the body. However, if you're not going to treat it, it will spread to the entire organ or to the entire system. It will spread into the body. It becomes systemic infection. And normally, if the patient has systemic infection, the microorganisms is also found in the blood. The term that we use, septicemia. Okay. How about this iatrogenic infection? Infection that results from diagnostic and therapeutic procedures. What are these infections? I'll give you an example. When a patient is admitted into the hospital, the patient undergoes several tests, several procedures, X-ray, ultrasound, blood extraction. There are a lot of procedures being performed to the patient. Okay. And because of these procedures, the patients develop infection. And the name of the infection is called iatrogenic, means the cause, the origin is because of the procedures performed. For example, if the patient is having chemotherapy, chemotherapy is for cancer, okay? When the patient frequently receive chemotherapeutic drugs, after few months or few years, the patients develop infection, not because of the disease itself, but because of the procedures performed for the patient. It is called as iatrogenic infection. And the last but not the least, this is very, very common, nosocomial infection or infections that originates in the hospital. I'll give you an example. A patient is admitted because the patient is pregnant. Pregnancy is not a disease. If you are pregnant, you don't have infection. You are just pregnant. The patient was admitted because she's pregnant. However, after several days in the hospital, the patients develop infection. Again, the patient is pregnant and admitted to the hospital. Okay? However, during her stay in the hospital, the patient has infection. And the infection that affected the patient is called nosocomial infection. Okay? Local infection, specific part. Systemic infection, other parts of the body. Septicemia, microorganism is in the blood. Iatrogenic infection, because of the procedures. Nosocomial infection, infection is from the hospital itself. These are the different types of infection that you will encounter in the hospital. Now let us see if you are able to apply the different types of infection with this question. Okay? And I want you to use your cell phones. Let us see if you are able to answer. Again, we have local infection, we have systemic infection, we have nosocomial, we have iatrogenic, we have septicemia. The question is, the patient was admitted due to severe headache. Okay? After a few days in the hospital, the patient develops an infection which was not present during admission. Okay? This type of infection is, let me see the answer. Okay? It seems that 100% are saying nosocomial infection, and all of you are correct. Okay? In the actual exam, we will be dealing with these kinds of questions, and I want you to learn how to answer with this. Our answer is nosocomial infection. Why? Because the infection was not present during admission, and it occurred when the patient was in the hospital. The answer is nosocomial. This 5% is not listening. Okay. Okay, any questions? We're done with that. Okay, now, we have already discussed the different microorganisms that causes infection to the patient. Okay, now the question is, do you have any idea how does infection occur or why infection occur? Because the microorganism itself is not capable of causing infection. In fact, there are other elements that should be present in order for an infection to occur. Again, the microorganism itself will not cause infection unless other factors or elements are present. So at this point, I'm going to discuss about the chain of infection. The chain of infection is very important because it explains how infection occurs. As I mentioned earlier, the microorganism itself or the microorganisms alone will not cause infection unless other elements are present. Okay? And the connection or the linkage, just like a chain in the drawing, the linkage or connection of these elements, okay, is called chain of infection, which means All elements should be present, okay? And a series of events should happen between these elements so that infection will occur. Again, the microorganism alone will not cause infection unless other elements are present. And all these elements should link together just like a chain so that an infection will occur. Any absence of any of these elements will cause what? Breakage in the chain of infection. Okay, for me to be able to understand, to discuss, and for you to be able to understand this chain of infection, what you will see in the slide right now, it's a circle. Okay? It is actually 6 circles, and you would notice that they are connected to each other. Okay, these 6 circles represents the different elements that are very important so that infection will occur. And you would observe in the element that the germs is only one of the element, which means this one, agent. Okay? The agent alone will not cause infection unless the other elements are present. And these should link together. What are these elements that should be present in the chain? We have the agent, we have the reservoir, we have the portal of exit, mode of transmission, portal of entry, and susceptible person. I'm going to discuss one by one how these elements contributes to the development of infection to the patient. For you to be able to understand why this one is important in the link and why this one is important because of chain of infection. Okay, let us start with the most important element of the chain of infection, which is called the agent or etiologic agent. Who are these agents? Just like what we mentioned earlier, these are microorganisms, these are bacteria, these are virus, these are fungi, these are parasites. They are one of the most important elements of the chain of infection. Okay? And for an infection to occur, of course, there should be microorganisms or agent. However, the ability of the microorganisms to cause infection to the patient depends on several factors. And you would see now on the slide the different factors that should be present. Okay, the microorganisms alone, okay, is important in the infectious process. However, there are factors that affect the ability of this agent or microorganism to cause infection to one patient. Number one is virulence, which means the ability of the microorganism to cause disease. This is very important. There are some microorganisms which are less virulent, which means even if you are not exposed, seldom you will get the infection because the virulence is less. However, there are some microorganisms wherein the virulence is very high. For example, the coronavirus, it is very contagious. Why? Because the virulence is very high. That's why a lot of people are infected by coronavirus. And this is an example of virulence, or the ability of the microorganism to cause the disease. Another factor is the ability of the microorganism to enter the body. What does it mean? Okay, remember our skin. Your skin is the first line of defense. If the microorganisms has the capacity to penetrate the skin even without the wound, then the patient will get infection. Okay? That is ability of microorganism to enter the body. And of course, another important element is susceptibility of the host. Even if the microorganism is very potent, even if the microorganism is very virulent, if the host, when we see the host, I am referring to the patient. If the host is susceptible means very weak. That's why he will develop the disease. Even if the microorganism is very strong, if the host is not susceptible because the host is very strong, the microorganisms will not cause infection. However, if the patient is weak, because the patient is old, or maybe the patient's immune system is very low, which means the patient is susceptible, even with a small amount of microorganism, the patients will develop infection. And the last would be the ability of the microorganism to live inside the body. Now, there are some viruses or bacteria which could not live without oxygen. They will die without oxygen. So why humans are prone to infection? Because humans, our body, we have blood, we have oxygen. Microorganisms will live inside our body. Okay? These microorganisms need oxygen. That's why they like people, because we have oxygen. They don't like dead materials or dead people. Why? They will not live there because they don't have oxygen. Because our microorganism, bacteria, virus needs oxygen in order to live. Okay, this is called agent or etiologic agent. Now, the microorganism alone, the bacteria, the virus, even if they're very strong, all of them requires reservoir. That's why the next chain of infection is called reservoir. In short, this is a place where these microorganisms live. Okay? And who are the most favorite reservoir of microorganisms, bacteria and viruses? Humans. We are their favorite reservoir. We are the most common reservoir for microorganisms. And aside from us, microorganisms also live in animals, in our pets. Some microorganisms live in soil. Some microorganisms thrive in water. Some microorganisms live in food. Okay? These are sources of microorganisms. Okay? Okay, wait, I think there's a problem. Can you hear me? Okay, wait, wait, sorry. Sorry to interrupt you, I think there's a problem. Okay, wait. Hold on, please. There's something wrong with my system. Hold on, please. Okay, while I'm fixing, please bear with me because there's the problem with my computer. Okay. Sorry to interrupt you because I encountered a problem with my computer. Okay, can you see it now? Sorry. Okay. Can you see my slides right now? Sorry. Okay. Wait, sorry. Okay. Something happened to my computer. Okay. Can you hear me? Can someone open this? Because I cannot open my chat box.
Yes, sir, we can hear you.
Okay. Can you hear me?
Yes, we can.
Okay. I will continue my discussion. Sorry, because my computer crashed. Okay. Wait, have, sorry. Wait, wait. I could not put back my my slides. Okay. Wait while I'm fixing this one. Sorry. Okay. I don't know what's the problem with this. Okay, guys, is it okay? I'll exit for a while and then I'll go back because I need to fix this one only for 30 seconds. Okay? Guys, anyone can answer me?
Yes, sir. Take your time.
Okay, 30 seconds only and I will go back.